Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Welcome everyone to another amazing episode of Bristol Health Cares. I am Kurt Barwis, your host, and today I am here with Dr. Verceles. Dr. Verceles, welcome.
Oh, thank you for having me. Well, I'm a podiatrist here at Bristol Health. I'm originally from California. I did my training in Chicago, and then I did my residency down in South Florida, and then the job brought me up here. So it's been great so far.
We're absolutely thrilled to have you as part of our team, and podiatry is so important. So tell us, why did you pick podiatry? What got you into podiatry?
So the funny thing is that when I was going into medicine, well, I'll circle back a little bit. I actually went to college thinking I was going to become a lawyer, and the funny thing is that I worked at a law firm, and I just knew it just wasn't for me. There was no windows. I didn't get to talk to many people. And so then I was like, I'm going to go back to school. So I went and shadowed a lot of different physicians. And my most favorite physician that I shadowed was a podiatrist. All of his patients loved him, is very down to earth. And the good thing about podiatry is there's different facets of it. So you can be in clinic, you could be a surgeon, you can do all kinds of things. And so that's kind of what won me over.
So long journey to get where you are, and a West Coast person who came to the East, so you like the cold weather.
Yeah, I don't mind it.
You don't mind the cold
nice
weather.
Coats are really good too.
So tell me a little bit about what you do for Bristol Health in the community.
Yes.
And what kind of patients you see and what kind of diseases you take care of or foot conditions that you take care of.
Yeah, so in Bristol we have a large population of diabetics. I work pretty closely with the endocrinologists as well as the primary care at Bristol Health, and so I see a lot of diabetics. We make sure that their feet are in good condition, that they have their full sensation, and so I do a lot of that. I also do a lot of outpatient surgery, so I focus a lot on forefoot surgery. So a lot of people with bunions, hammer toes, any type of foot pain. So I do a lot of that. And then I also work inpatient sometimes, excuse me.
Sure.
And at the wound care center. So I actually treat a lot of people with wounds, either they're arterial, diabetic foot wounds, or traumatic wounds, and I help to heal them out. And so it's very rewarding when you see a wound the size is, a big circle like this turn into nothing. So it's really great. In terms of the outpatient surgery, I'm actually doing a lot of minimally invasive surgery now. So with the typical bunion, back in the days, they used to do these surgeries with probably a 3-inch incision. And nowadays we can do the surgery, same surgery, wonderful outcome, but with these tiny, maybe 1 centimeter incisions now.
That's
and
amazing.
So it's more cosmetically peeling. They can walk sooner. They can wear a shoe faster, back to work sooner as well. So that's kind of where my focus is on when I do a lot of surgeries now. That's
a big range of things that you take care of on feet. And I take care, for me personally, having plantar fasciitis for a year was like a wake-up call about how important your feet are. And people with foot issues struggle, walking around, ambulating. I still remember trying to get out of bed in the morning and stretching, taking that first couple steps, and my wife looking at me and saying, "You're really getting old if you can't walk." But it wasn't just that. It was just, how it impacts your everyday function. And you mentioned diabetic foot care
Yes.
and how critical that is. The state of Connecticut has significant number of diabetics. I'm not sure why that is, but I know that the cost of diabetic care in this state, and I'm going to throw a number out there, it's $1.7 billion a year.
Wow, yeah.
It's huge.
It is huge.
And the thought process around, that is, if we could just do a better job of taking care of those individuals. So from a foot care standpoint, tell me what that involves, because I think, especially with diabetics that are maybe have had diabetes for a while but haven't really experienced that problem yet, what should they be thinking about?
Yeah. So definitely, that's why it's kind of great at Bristol Health that we have the medical care center in particular. So we have primary care, endocrinology, and then we have our podiatrist. So the thing about diabetics and podiatry is that with time, with these people who are non-controlled diabetics, they start to lose sensation in their feet. So they pose this really big concern for infection. And so if they cut their nails too short and cut themselves, they don't feel it. And so that can lead to, infection and then having to become a patient in the hospital, stuff like that. Yeah. So the thought process is that if we work closely with preventative care, that if we track these diabetics and make sure that their sensation is still intact, that we can keep a closer eye at them, and that we educate the diabetics more to do daily foot checks, always making sure that they don't step on anything, cause, an injury to themselves. And so I usually have the patients come see me. We do a diabetic foot check. We make sure that their sensation's intact, that their blood flow is good, because that's another factor too. We have a lot of diabetic patients with poor blood flow. A lot of them were longtime smokers, several packs a day for 30 years. And so we work very closely with vascular surgeons too. But with the diabetics and preventative care, we hope to keep an eye on these patients. So if a patient comes in and they aren't even they didn't even know that they are diabetic, they see a primary care, they tell them, I'm actually diabetic. And, so then they get referred to me, and then we do a foot check, make sure they're all good. And then when I do my foot check, if I find that they have no pulses or something like that, then I refer them to a vascular surgeon. So a lot of the time, these people had no idea that they had poor blood flow or anything like that. Right. And so we kind of bring it to their attention so that we can kind of keep them from becoming a patient in the hospital or losing their toe. Yeah. I had a patient the other day, uncontrolled diabetic, had some pain, and usually she doesn't feel anything. And so she was having this stabbing pain in her foot. And I look at the bottom of her foot, and I see this kind of like a wound, or you could see that she maybe have stepped on something. And I pushed on it, and it hurt her so bad. So I did an x-ray, and we see that there is definitely something in her foot. So I did like an emergent incision and drainage, and I explored around, and I got a piece of glass out of her foot.
Wow. And she didn't even know it.
Yeah, and she didn't know. So that's the real threat of these diabetics, because they can walk around several days, not realize that they actually have something in their foot, or they notice blood in their sock, and they're like, oh my gosh, where is this from? Yeah. And then they didn't feel a single thing.
Wow,
so
it's incredible.
Yeah.
So just a question about that. Mm-hmm. So a person that's diabetic and they're starting to age and have issues,
yes,
how often should they be getting their foot taken care of?
So usually when someone's high risk like that, we usually recommend 3 months. If somebody's a little low risk, they still have their sensation, we push it out 6 months to a year. And those are the people who are controlled diabetics, their A1C is under 6. But I do have a lot of patients who are A1C 10, 12, and those people are very high risk. Yeah. And so, a little cut on them can present as a really bad infection. Diabetics tend to heal slower too. Yeah. And so when that happens, it leads to these amputations. So a lot of people, they've heard of oh, my family member had diabetes and they lost all their toes. And usually that's why a little infection that could have been stopped, or, at least a doctor would have known about, and then it would have saved their foot. So a lot of podiatrists, myself included, we work on limb salvage. That's what we call it. So we try to save the toes, we try to save the foot, but sometimes unfortunately, things are far gone where you have to have amputations.
Yeah, my brother is a child diabetic. Mm-hmm. He's older than me. So by a couple years, he became diabetic at the age of, I guess he was probably 11, mm-hmm. 10 or 11, type 1. Mm-hmm. And, so fortunate. I've kind of lived through the evolution of
Yeah.
his disease, and so constantly going to get his feet checked.
Yep.
This, he has the circulation blood flow problems that you talked about. The other thing he didn't do very well was to have his eyes checked.
Oh, yes.
Because it's very expensive to
Yes.
go, and that's part of the problem is the expense of going
Yeah.
to get your eyes checked, your feet checked,
Yeah.
and then you got to go to the endocrinologist and all those
Right.
other things. And so he thought it would be a good idea that he could avoid going to the eye doctor.
Oh.
And he ended up, having a
Yeah.
bleed and losing the sight in one of his eyes.
Right, exactly.
And so for me personally, I just know, I know it can be expensive to do all these things. But as you point out, going for the preventive checks is so vitally important.
Yeah, exactly. And just by doing that, a quick 15-minute appointment can really save your foot. And so that's the kind of the draw of having this medical care center, because it's a one-stop shop. So a lot of my patients, they'll synchronize their appointments. So they go upstairs and then they go downstairs, and they can even have their labs drawn all in one
and
day.
Get a Starbucks. I don't know if I'm allowed to say
And
Starbucks
they can
on
get a
here.
Starbucks
Yes,
there, too.
they can get a coffee, and I see that actually. And there's actually, the medical center is absolutely an amazing consolidation of different specialties to make it convenient for patients. So,
and another thing that like a patient brought up to me too was like the parking is great there, because they used to see other providers where parking was only on the street or there's no handicap parking. So when they come to the medical care center, it's actually a big deal that there's parking spots, there's a turnaround to get dropped off at. So those little things really make a difference to the patient.
I resisted for a long time spending the money to build that medical center, and then we were able to do it and consolidate things. And it to your point, everything you're saying is so true, and it's been so well received by the community. And now, when I look at it and I see all that other economic development around it, all Wheeler clinics going in, you've got Carrier putting in houses and restaurants and things like that. I mean, that to me feels really good. And now I feel even better knowing how you talk about how the patients get taken care of. I mean, I know that, but yes. So now, a lot about diabetic care. What other conditions, you talked about circulation, so maybe you're not diabetic, but you have vascular issues or blood flow issues. So what should people think about about that? Like, so if they have heart disease, if they have other conditions, how often should they be getting their feet checked, so to speak?
Yeah, I mean, it's always funny because I have patients who have never seen a podiatrist before, and they would have no idea that they had a blood flow issue until I feel for their pulses and there's no pulse. Wow. And so it's very important. Like it's funny how our specialty just works with so many different specialties. We even have patients who come in with foot pain and they had like a weird bump on their foot all these years or a growth. And then people would just tell them, oh, it's no big deal. But then we see it and we biopsy it, or it could be a cancer. So, that's happened too before. So it's always good just to go see a podiatrist. And if you have any foot concern, whether it be your nails, and we see other things too, with just like calluses, we see ingrown nails, we see a lot of pediatrics now too, which is really good. And pediatrics are just prone to having ingrown nails. I don't know, for whatever reason, they pick at their toes, they pick at their feet, or they don't cut their nails right. But yeah, we see a lot of pediatrics with ingrown nails, warts, anything like that. So any even though they're not like really big, medical concerns, like if something's hurting your foot, something's going on.
So warts don't sound so bad, but like, what can happen with warts? I mean, it's like, they can get bad?
Warts can actually spread to other parts of your foot. You could start off with one wart and it can grow bigger. You can have it go to the other foot, or you can actually infect a family member if you use like the same shower or walk barefoot, stuff like that.
So it's really not a good thing.
Yeah,
at all.
Not a good thing.
It's interesting you talk about, the losing the sensation or the feeling in your foot. And I lived through this with my dad as he was getting into his 80s. And he would always say it was something else, whatever it is. So I took him to the medical center.
Yeah.
It turned out he had a serious vitamin B deficiency, like so bad that he had to get shots.
Yeah.
But it was causing him not to be able to feel his feet.
Yeah.
And so, of course, how did that kind of play out. Well, he still wanted to drive.
Yeah.
So he was hitting curbs,
Oh.
he was hitting things, and, you know, having little fender benders. And, you know, then we were going through the whole issue of maybe you shouldn't have your license, but that was the independence discussion that
Right.
you really can't have. But having him checked and then addressing the issue put that feeling back in his feet.
Yeah.
And it made him more stable.
Yeah.
Because he was falling all the time.
Oh, yeah.
You know, and it wasn't because he was diabetic.
Right.
He had some vascular issues,
Yeah.
but really had to do with a surgery that he had, abdominal surgery that he
Uh-huh.
had, where your body absorbs that vitamin into your system, had been taken out and resected
Oh,
or
wow.
changed.
Yeah.
And so unfortunately that was, you know, how it all
Yeah.
confessed. But again, it came back to his feet, not being
Right.
able to feel what he
Yeah.
couldn't feel the gas pedal and the brake.
Oh, wow. I've had a lot of patients actually, kind of the same thing, where they're having numbness in their feet, but they're not diabetic. And then once we dive a little bit deeper into the conversation, you'll find out that they had a back trauma of some sort.
Yeah.
And so, you know, a lot of the times too is like myself and Dr. Baraimo share patients because, you know, they have a back issue that I find I send to him, or he has like a patient with numbness in their feet. And so, you know, we all kind of work together with some patients, but a lot of the times too, people will have this numbness with a otherwise normal history, and it'll go back to some type of back trauma from a car accident or a fall, because the nerves just run all the way down to the foot. Yeah.
So is there like an easy, as you're talking, it's like, you know, is there an easy way for someone to kind of like do a self-check of the numbness? I mean, because like maybe you don't know
Yeah.
until something happens.
Yeah, there are these little monofilaments that you can buy. You could buy it on Amazon. And then you can actually just poke your toe. And like a lot of the times, even if you're looking at it, if they're looking directly at their foot and they're poking and they just won't feel it. But when we do our test, we make them close their eyes usually. Yeah. And we could be poking and poking away at them and they won't feel anything. Yeah. And so they could do that at home.
Yeah. I mean, that's really an important thing, is for people, I mean, more than anything, be aware.
Yeah,
and
being
then
aware.
and talk to people, talk to your family members, and most importantly, talk to your primary care physician and get to see a podiatrist.
Yeah,
You do
exactly.
screenings out in the public every once in a while
I
too,
do,
right?
yeah.
Talk
So I've
about that.
done it like every time we have a local fair. You know, I've been out there. We did the Mum Festival, the Apple Harvest Festival. I even did the Senior Fair too. So I've been out there in the community trying to just help out, you know. And a lot of the times people, they just don't know what's causing their foot pain, but there's always a reason for the foot pain. It could either be their biomechanics is bad, they're wearing the wrong shoes, stuff like that. And so just kind of making people aware is like the big thing. Because a lot of times people just think, oh, well, my foot just hurts and maybe it'll go away. But usually something has to change for it to get better.
But I think the point that is really important for people to understand is, when you go to these fairs and you see a check, you know, like people get their blood pressure checked, right? It's really important to also get your feet checked. Don't pass that booth with the free foot screening. It's so vitally important. And you know, you just talked about getting proper, you know, sizing of your feet. I was startled. I had a problem where I've had a shoe size my entire life.
Yeah.
And I was hiking and somebody talked me into climbing up a mountain, and I lost my foot, my nail. And so I went and got another pair of shoes, and the guy said, we need to check your foot to see size. I had grown a half a size.
Right.
And is that true? Your feet keep growing?
Yeah, your feet can either grow, they can shrink. 2 feet could actually be 2 different sizes.
I definitely
as well.
have that issue, by the way. I bought sneakers this weekend. I have 2 different size feet. So getting them checked every time you buy shoes.
Getting them checked. If you are going to go shoe shopping, you know, go shoe shopping in the afternoon is what I tell my patients, because that's when your feet are more swollen, and so that the shoe will fit better. Because if you buy a shoe during the daytime, your foot's pretty skinny and, you know, like that. But then as you walk and the day goes on, your foot will swell, and then your shoe will be too tight. So essentially, you want to have enough room in your shoe. So you have to account for it by buying shoe when your feet are more swollen.
They have all these really complex things when you go to buy shoes. Like you can get on the treadmill and they have computer, you know, image. Does that stuff all work? Is that real?
You know what? Sometimes I think they work, but you can see like where people put pressure on their feet. We actually do 3D scans in our clinic now too. So we do our own orthotics. We send them off to a lab, and it's actually very good. I've had a lot of patients do it, especially when they have a complex type foot, and we can get them a custom insert, and it works wonders for them.
Wow.
But yeah, we do a 3D scan. It's very cool. We use an iPad, and you can actually see, and patients are amazed too, because you'll see every little crevice in their foot that's, 3D. It's very cool.
I think I need to come have that done,
Yeah.
just to make sure. But no, that's really, really important. And then, so when you think about where we're going in terms of our podiatry program at Bristol Health, what's going to happen in the future?
It's crazy because we hired on another podiatrist, and he's another phenomenal physician, and we just keep growing. Like, I haven't not been busy, and he's getting busy. There's never an end of foot problems for whatever issue. So it's great. And so I think we're building our practice to be pretty amazing. We both work at the wound care center, so as many wounds that I heal, he heals many as well too. So it's complex, but it's really great. I'll have to show you one day, like, all of our before and afters with these wounds, because it's amazing. Yeah.
You really, I could tell how excited you are about that. I can see that in your face.
Like, when you physically see somebody for several weeks and they had gone to a different facility, they were never healing, and then they come see you, and then boom, they're getting better,
So do you use hyperbarics at all?
We do. So we
Really?
use hyperbarics, but a lot of times, a good surgical debridement, the correct wound care products can really get these things healed.
When you use the word debridement, that's cleaning out of the
Cleaning
wound.
out, yes. So cleaning out on any of the bad tissue, any of stuff that would impede healing. Yeah.
Awesome. So you're excited. We're excited to have you here. And it's amazing that we've grown this practice so much.
Yeah.
And the other part of it is you work really well with orthopedic surgeons.
Oh, yes.
And it's just an exciting future for us. So any last words?
No, I think the important thing is to, get your feet checked. Don't walk barefoot, just for the safety of it. And then I'm at the Riverside 15 Riverside Avenue, MCC. And then I also have a satellite office in Southington. So, and then my colleague has an office in Plainville. So
that's awesome.
Yeah, we're out throughout the community, ready to help.
Dr. Verceles, it's been great having you here today. Truly amazing. When I first came here, I didn't know that we would have this great podiatry practice, and I heard a lot about how important it was, and then I saw it play out, just because, like you said, some people go through stages of losing parts of their feet, and this community needs it, it's no question. So thank you for being here.
Thanks for having me.
Thank you all for being here today for this episode of Bristol Health Cares. I'm your host, Kurt Barwis, and a special thank you to the Nutmeg TV crew for producing this program. And again, you're going to see an email that you can write into with your questions and concerns. I'm happy to have anybody on this program to talk about those things and interview them. Have a wonderful day and stay healthy, please.